What is congestive heart failure? Congestive heart failure, also known as CHF, is a health condition in which the heart muscle is unable to pump enough blood throughout the body. This pumping failure results in the reduction of oxygen and nutrients to vital organs, such as the kidneys, brain, and liver. What are the signs and symptoms of CHF? In the beginning stages, the heart tries to compensate by enlarging its chambers to allow more blood to flow in. The heart muscle then increases the strength of the contractions to pump out these larger volumes of blood, as well as increase the heart rate. The increase in rate and force of contraction start to overwork the heart, resulting in an increased muscle mass to the walls of the heart chamber. Signs and symptoms of CHF are present when the heart no longer has the ability to compensate. Examples are shortness of breath, edema, fatigue, pallor, confusion, restlessness, and brain impairment.
Shortness of breath is where the blood starts backing up into the lungs, causing congestion. Wet lungs have difficulty exchanging oxygen easily, and the patient will become wheezy. Edema is caused by poor circulation and fluid accumulation in the legs, ankles, feet, thighs, and abdomen. A sudden increase in weight or abdominal girth also are signs to watch for. Pallor and cool extremities result from decreased cardiac output, causing vasoconstriction to the patient's extremities in order for the body to conserve blood for its vital organs. The extremities will feel cool when touched and will appear lighter than normal. Fatigue is the result of less blood reaching the muscles. The muscles are not receiving the acquired oxygen and nutrients needed, and this causes the muscles to tire easily and the patient to feel fatigued. Confusion, restlessness, and impaired memory can develop because of brain hypoxia. Brain hypoxia is where not enough blood is being pumped to the brain due to the decreased cardiac output. This results in decreased oxygen distribution to the brain. What are ways to prevent CHF? Lifestyle changes are the key. This includes diet changes, exercise, not smoking, or using illegal drugs. The diet should be balanced with fruits, vegetables, carbohydrates, and proteins. It should consist of low fat, low sodium, and low sugar foods. The carbohydrates should be 40 to 60% of daily calories. Examples of these would be fruits and whole grain breads. The protein should be 12 to 20% of the total daily calories, and examples would be meats and legumes. Fat should be 30% of the daily calories, and monounsaturated fats are the recommended fats to use. For exercise, the American Heart Association recommends 30 minutes of moderate to intense aerobic exercise 5 days per week, plus 2 days of moderate strength training, or 25 minutes of vigorous aerobic activity 3 days per week, plus 2 days of moderate strength training. How is CHF diagnosed?
CHF can be diagnosed in many ways. During a physical exam, the doctor will assess for any of the signs and symptoms mentioned earlier. They will listen to the heart for any abnormalities as well as the lungs to assess for any fluid buildup. There are also several diagnostic tests that can be performed, including an electrocardiogram, echocardiogram, chest x-ray, stress test, and cardiac catheterization. An electrocardiogram shows the electrical activity of the heart. Arrhythmias can be seen using this, and the most common associated with congestive heart failure is called atrial fibrillation, or AFib for short. An echocardiogram is an ultrasound of the heart. It can help visualize any abnormalities of the heart, as well as measure the ejection fraction. The ejection fraction is the percent of blood pumped out of the heart through the aorta and pulmonary artery. This gives us a better understanding of the heart's ability to pump the blood out to the body. An ejection fraction less than 50% indicates heart dysfunction. A chest x-ray will show if the heart has grown in size or if there is any fluid present in the lungs.
A stress test, also referred to as an exercise test, measures how the heart and blood vessels respond to exertion from exercise. Cardiac catheterization is a test done to check for any narrowed arteries due to plaque buildup in the arteries supplying blood to the heart. Narrowed arteries can result in heart malfunction.